How do you tell if you sprained your finger or you broke your finger? Well, I'm here to share with you what I would look for. If you came to me and you're like, Huang, what happened? What do I do now? My name is Huang. I'm an occupational therapist and certified hand therapist, and I help people with hand and arm injuries. So, this is a very common question. Like, if you did something and you're just not really sure, but your hand hurts constantly, right? Did you sprain it or did you break it? Which one is it? Okay, let's talk about breaking first, fractures. Your bones are actually really, really strong, and you have to have something that has been like a high impact. Let's say you fell on it. Let's say you slammed a door on it. Let's say you did something that was really, really heavy. I actually had a patient of mine. He was playing finger wars with one of his friends, and they played so hard it actually broke his finger in a diagonal pattern. And that's because broke his bone in this diagonal pattern. And it was because they put so much pressure in twisting it. So the way you realize whether you have a sprain or whether you have a fracture, whether you broke it or not, the best way, obviously, is through x-ray. X-rays are great at seeing if you have a fracture. It's great at looking at bone. It's great at looking at the position of the bone. It's great at looking so it can tell also if you have a dislocation, meaning maybe you fell and you twisted it and you sprained a ligament and it's not now sitting in the position it's supposed to sit in. That's the best way to see whether you have a fracture or not. You probably can tell if you injured it so bad that it's fractured. Usually, especially in the fingers, you'll have a lot of swelling. You may start to lose motion, right? And so that's going to be an indicator. So your story of how you injured it is usually a way of knowing whether you broke it or not. If it's pretty severe, if it was a high impact, hard hit, take yourself to the emergency, get x-rays. You can go to the emergency room, you go to hand surgeon, you can go to urgent care center that will be able to take x-rays for you so that you can know for sure, right? Now, number one is the story. Number two is the impact, right? Number two is how hard was it? And then number three is if it's broken, you'll start to lose motion, especially in the fingers. You'll start to lose motion. And that's an indicator to you that, hey, it's broken. I really need to take care of this. When you have a sprained finger, and I've done this to my fingers, you might have done this to your finger. I was carrying groceries, and as I was putting it down, it was a bag, it was pretty heavy. It got caught onto my finger and it yanked and pulled really hard. And then when I took my hand out, I was like, oh, that kind of hurt. And I felt it, but then really the sharpness of the pain went away and I was able to move my hand. That's usually an indicator of a sprained finger versus a fractured finger. What happens, we have these structures in our knuckles, right? In the big knuckles, we have in between each one, we have these ligaments. They're called collateral ligaments, and they help kind of hold our joints together and give us stability in our fingers. Well, our big knuckles move a lot, and they actually can move side to side. And those ligaments kind of hold everything together so that we can move without pain. When you overstretch it, that's what a sprain or strain is. When you overstretch it, it can cause pain. We have these collateral ligaments on the sides of our middle knuckle too. So this is a big knuckle, this is the middle knuckle, and this is a little knuckle. And we have collateral ligaments essentially around each joint that kind of holds our joints together, doesn't let it move side to side if it's not supposed to, and it gives us stability so that we don't have pain. When you tweak that or when you put a lot of stress on it, one of the things that happens is we can get little micro tears in it. We can get it can be overstretched and cause inflammation, cause it to have some pain. So, well, what do you do about it? Most of the time, you'll see that you still can have motion, but it keeps hurting, right? So I don't know about you, but that's what happened to me. And that's what I usually see when patients come in and they've sprained their finger. One of the biggest things that we do as therapists is we help to determine whether you have a little small sprain or if it was sprained so bad that you tore it. Because if you have a little bit of a tear or a medium tear or a big tear, it helps to determine what you do from a treatment perspective. So I can't essentially go through all of that right now with you based on what you have, but if you sprained your finger and it hasn't gotten better in about 2 weeks time and it still persists and it's still hurting, it's going to get in the way of how you use your hands, because we rely on our hands for everything. There's pressure on our knuckles when you try to open the door, when you try to grab something and hold something, you'll start to feel it. If it doesn't go away in about 2 weeks time, you'll know like what else is going on? What else can I do, right? Sprain and strains can take a little bit of time to heal. Usually between 4 weeks, it gets a little bit better. By 6 weeks, it gets better. And by 8 weeks, it's, even better. And it just depends on, how severe it is, right? So if you're not really sure about how bad your sprain is, definitely go seek an occupational therapist, a certified hand therapist, so they can help you determine like what else is going on, what type of treatment you need. And if you think you broke it, please go to your doctor, right? And then after your doctor helps you to decide like, is it broken? Do you need surgery? Can we treat it without surgery? Then you'll follow up with your trusted hand therapist, right? I hope this video helps you if you've sprained your finger, or you have any questions about whether you sprained it or broke it. And in another video, I'll share with you some ways that I would treat a sprained finger.